All right, guys, welcome back. So, this is Moses, the fitness master. So, today we're going to be looking at a very wonderful topic, which says differentiating, uh, you know, differentiating three different concepts from each other, which looks very familiar, sound very familiar. However, these three concepts are not the same. You might have heard about them, but they are not what they are not the same. So let's look at them. What they entail. Let's look at what they entail. Let's x-ray them gradually. Okay, so you can see the term on your screen. So the term is differentiating or difference between physical fitness, health fitness, and medical. You see it as a young boy who was an undergraduate student in the Department of Kinesiology and Health Education. I can say that these very three concepts were the concept that actually, when I came across them in exercise physiology, when we're doing basic introductory exercise physiology, I was lost when I saw these three concepts. Then I saw health fitness, then I saw medical fitness. I was lost. That's the truth of the matter. However, today let me break it down for you in case maybe you have seen any of the three somewhere and you think that the three are the same thing. The three are not the same thing. In fact, to be quite honest with you, they vary from one to the other, although they have some very little similarities. However, they are not the same thing. Okay, so let's start with the definition of physical fitness. You see, physical fitness is, the ability of your body to perform physical activities efficiently without undue fatigue. That means, just as I am talking now, my ability to perform all of these things that I'm actually saying now, to perform this task of me sitting here and talking now without undue fatigue, is what you refer to as physical fitness. What's happening to me now, I'm able to talk to you and you're able to hear the concept that I'm actually explaining now is the concept of physical. You understand? Now, I think I did a particular podcast, I did a particular topic, I think yesterday on a live stream. I think it should be available on this channel already, where I talked about components of physical fitness. So again, I will just, give a little hint on it before we continue with this differentiating these three. And, physical fitness has two main components, which is the health-related component and the skill-related component of physical fitness. Now, the health-related components include cardiovascular endurance, muscular strength, and muscular ability, as well as body composition. That's the health-related components of physical fitness. Now, if we go further, now go look at the second major component that it has is the skill-related component of physical fitness. And under that, we have speed, we have agility, we have power, we have balance, we have coordination, and we also have reaction time. So these are the components that physical fitness actually has. Now, what's the main purpose of physical fitness? You see, physical fitness is designed, the purpose of all of these its component, both the skill related component and health related component, is to enhance physical performance for general activities or for athletic pursuit. You understand? So you want to improve or you want to enhance your physical performance, either for your general activity or your general daily task, or for athletic what pursuit. So it does not mean that it is only athletes. This means that it's not only athlete that should be physically fit. People or persons who are not athletes as well can also or should also decide, should take it as a point of duty upon them to also upon themselves to also what to be fit as well. That's what this concept actually means. So that's for physical fitness. Then if we go further, let's now look at the concept of health fitness. Okay, so health fitness, is a subset of physical fitness that is specifically focused on maintaining health, preventing disease, and improving overall well-being. You understand? You see, why physical fitness has to do with, performing your task without unnecessary fatigue. Health fitness, on the other hand, is telling you that a subset of physical fitness that is physically focused on maintaining health and preventing diseases, as well as improving your overall well-being. You understand? So, here is the main component here is the health related component of physical fitness is what makes up the component of health fitness. You understand? And this includes health, cardiovascular endurance, muscular strength, flexibility, and body composition. Now, the purpose of health fitness is quality of life, reduce the risk of chronic diseases such as diabetics, obesity, hypertension, and promote long-term health. The purpose of health fitness is to promote long-term health, prevent diseases, maintain, focus on maintaining your health, as well as improving your overall well-being. That's what the purpose of health fitness, that is what it entails. You understand? And among promoting your health and well-being, your long-term health and well-being includes reducing the risk of chronic diseases. You see, majority of people are that actually people actually dying with now are diseases that are associated with lifestyle. That means what people eat and how they live their life. Let me communicable diseases plan. You understand? So when you want to ascertain someone's medical fitness, you don't just look at the person's tissues, then you just certify. No, you place all of these organs and this system, you put them to what we call a stress testing. And this stress testing will reveal the extent of efficiency that these particular organs and this particular system can actually function. And with this, you can answer medically this person is fit for this, is fit for that, and stuffs like that. Now let's continue. Now let's look at the key focus of medical fitness. You see, the key focus of medical fitness includes the three that I'm about to mention, which is one, managing and improving existing medical conditions. That means medical fitness, like we said, is used to assess and tailor to individuals with medical conditions or specific health concerns. You understand? These people have medical condition or specific health concerns, so you want to use exercise as part of the therapy as their treatment plan or as a preventive healthcare plan to prevent this. Maybe if this particular person has not actually this particular person has not actually have that disease, you want to prevent, use exercise to prevent it. Or if that person is already suffering from that particular health condition, you want to use exercise to manage that particular diseases to ensure that it does not grow worse than the way it is, and even make the person get better. And then number two key focus of medical fitness is that rehabilitation after surgery or injury. You understand? You see, in time past, I've been contacted to, I've been contacted for pers to give therapy to persons who are stroke patients who are recovering. I think on two occasions. Then I've also been contacted for, I think the second one I'm about to mention now were about two different cases from two different persons, 2 different years. These persons, they had accident, and there was no fracture. Scan and X-ray reveals that there is no fracture, no broken bone, there is no damage, but just that these people, they cannot lift any part of their body at all. You understand? Not like maybe there is a puncture. No, there's no puncture, there is no wound anywhere. But these people, they can't lift any part of their body. You understand? And we give rehabilitation to help these people recover this part of their body that seems as if they are not able to use them, to the extent that even if you lift their hand like this, they will shout excessively, as if you are hurting them, meanwhile you are not actually hurting them. You understand? So fitness is also used, medical fitness is used as a rehabilitation for such kind of cases. Then I also had a case that was also brought to our laboratory, somebody that actually did knee surgery. So all of these is what we use as rehabilitation. This is how we use medical fitness as rehabilitation after surgery or injury. You see, when it comes to injury, I think I've handled countless number of cases of me, actually handling cases associated with injury, even the one domestic injuries, some involving fracture and sprain, dislocation, stuffs like that. The ones that actually do not actually handle at the moment, because our lab do not have you know what it takes to actually remediate that particular case. So it's the reason why if you bring for me somebody who had a fractured bone, that person to a hospital, either a teaching hospital or a specialist hospital, that where I know that they have an orthopedic unit. You understand? Then in some cases, some of these people might go to, tradomedical, although there are some tradomedical who are also specialists in, and treating fractured bone, and, this person will still walk normal after the treatment and, the various process. You understand? So, and I don't have issues with that. My own concern is that if this is what you are doing, and there is producing results, is have certification, just in case that things go south, you'll be able to what, to be able to save your trial and error. A day might come that you might not be able, that trial and error might not be able to work. So another key focus of fitness, key area of medical fitness, is that fitness for those with specific physical and functional limitation. You see, there are people who have some particular physical limitation or functional limitation. Either maybe actually have a complete range of motion, and And this might have been happened for over years, either or they were even born with it. You understand? Medical fitness actually helps to correct this, and it will take a very long period of time. It's not something that you just expect that will happen in a couple of 1 month or maybe 2 weeks or 3 weeks. No, it won't happen. If I happen to be one who receives you, I will just tell you that, sir, ma, I would like you that when you are envisioning this possibility, even if it happened that I will be able to give it to you, help you achieve it in 6 months, I will tell you to put your target to be 1 year, so that when the plus and minus happens, it should be that we got it earlier. Then I, on my own side, I'll be what? I will be happy and I will be at peace, rather than setting a very tight goal and we are not able to achieve it. It will now look as if maybe I didn't know what I was doing, or I don't know what I'm doing. So that's how we actually handle these cases that are similar to such. Then the purpose of medical fitness. We look at the key focus now. Let's look at the purpose. Now, the purpose of medical fitness is to what? Is to enhance health and functionalities in individuals with medical concerns and to prevent worsening of health conditions. Now, I said that some cases these particular persons are having existing medical condition. Medical fitness is more associated with existing medical condition, preventing it from happening, or the ones that are already happening, we are trying to remediate, to prevent it from getting worse. You understand? So medical fitness is more associated with person that fault has been detected. So we don't want the fault to deteriorate. We don't want it to get worse, or we don't want it to become more critical than as it is. So we delve into into action, and we start putting things in place. Now, this involves, a collaboration with healthcare professionals such as sports medicine experts, exercise physiologists, then in some cases, physiotherapists. Although why is the physiotherapist handles more of, elementary. When they handle the elementary, they further send to us who are exercise physiologists. Yes, majority of physiotherapists can actually handle complex cases that has to do with, especially maybe if it's surgery. They just handle the elementary, such as restoring maybe the person how to move a particular part. Then maybe he starts learning how to do it, having a minimum movement in those parts. Then the next thing they send to exercise physiologist. And it's also a supervised and customized fitness program. That means these people, you don't just give them any program, and you don't just give them a random program. Their program is customized and is supervised. For instance, if it happens that maybe I'm giving someone who maybe like the case I explained of two various persons that they had accident, and there was no broken bone, no fractured bone, no dislocation, no fracture, no sprain. But these people, they can't even, one finger like this, they can't lift it, use it to even carry anything. Touch any part of the body, they shout, they scream as if you are hurting them. This kind of people, you give them very, very customized fitness programs. And majority of the cases, if maybe the person who is taking care of them, if they are not buoyant enough to have a means to bring them to the exercise physiology laboratory or therapy center, it's most likely that we actually have a home session where we actually would administer therapy to these people. You understand? So that's those are just kind of I've defined them now. So let's look at the key differences in a nutshell. In a nutshell. Now, we're going to look at the aspect of physical fitness, then we go to health fitness, then we look at medical fitness. Now, the focus of physical fitness is general fitness and performance. That's the focus of fitness. Then the focus of health fitness is promoting health and disease prevention. You understand now? I believe that I'm about to talk about, even if you have not you didn't understand anything that I've been saying in the beginning, this particular session would be easy for you to understand. Then the focus of medical fitness is fitness that is tailored forward for medical conditions. It must be that it's a medical condition, not just any condition. You understand? Then of physical fitness is both health related component and skill related component. Performance is to improve overall physical performance, to enhance and reduce disease risk. Now, look at now. Physical fitness, the purpose is to improve overall physical what? Performance. The purpose of health fitness is to enhance health and reduce disease risk. That means even if the disease will happen, we want to reduce the risk of it happening. Not necessarily eliminating it. However, we reduce the what? We reduce the risk. That's what we do. Then for medical fitness it has happened. So what do we do now? We are managing as well as rehabilitating somebody who is already in that medical condition. Maybe he's in surgery. They've discovered at the hospital that, this, or let me just use the word that doctors have done their best. And, I discovered that for this person to have the best of result, this and this and this and this is what he or she do to have the best of result. Now that we have done our job. So it's like, after the doctor have done his or her surgery, and now it is now the nurse who nurses that particular patient till stuffs like that. All the doctor is just to do is to do ward round on a daily basis, stuffs like that, to check up on how the person is recovering. You understand? Then who are the target audience of physical fitness? Is general population and athletes. That means everybody, including athletes, are the target population or the target audience of physical fitness. That means everybody should be what? Everyone needs physical fitness. Then the target audience of health fitness is everybody, general population. Then who are the target audience of medical fitness, or who desires or who deserves medical fitness? It's simply individuals with what? With medical what? Issues. Then the supervision of physical fitness is often self-guided. You may not necessarily need a guider or too much supervision for physical fitness. However, for the supervision of health fitness, you need self-guided and general fitness instructor. You understand? For you to get best of supervision. Then for medical fitness, you are supervised by medical or health professionals. You understand? Remember I said that actually handle cases. In fact, there are cases that by virtue of being an exercise physiologist and some other, we've done some, we've acquired, at times, we acquired too many that, in some occasion, some cases I even been referred from other fitness centers to my center, simply because they believe that I am the one who can actually handle such cases. So the supervision of medical fitness is supervised by medical or health professionals. You understand? So this is just a little key difference between physical fitness, health fitness, and medical fitness. And I explain these differences now using the focus, where each is focused on, the components, or what as the component of each and every of these, the purpose of the three, the target audience of the three, as well as the supervision of any of these three that we actually what talking about here. Then the supervision. How is the supervision? How does it what? How does it actually happen? Then in summary now, let me just summarize it, and that will be the this thing. In summary, physical fitness focuses on general performance, while health fitness emphasizes overall health and disease prevention. However, hand is tailored to individuals with specific medical needs and requires professional oversight. Not just anyone overseeing these people, they must be professional in what. For instance, as a general fitness instructor, you cannot handle cases associated with medical fitness unless you are very experienced with human anatomy and physiology, and you are an experienced fitness trainer. That's the only way. And even at that, you might still have some little challenges. You understand? Because you have, while you are there, you have no choice rather than to occasionally, or even either on a weekly basis or twice a week basis, you communicate with this person's doctor to tell the doctor the progress that you are making. And you also even tell this person that, please, this is the next, by the end of today, please, you send their report sheet or their assessment sheet, you send it to their doctor. That if you cannot discuss it, if you feel that you cannot discuss it over the phone with the doctor, you send the assessment sheet to the doctor. Then the doctor takes his own medical parameters over there to ascertain how this person is now doing. While you seeing what is happening physically, he goes there and the doctor actually what now does all of his screening, examination, tests, the rest of them. Then the doctor refers back to give you some kind of directive to include in this person's customized programs based on what he has seen from what you've been giving to him. Just stuff like that. So there's a reason why it requires professional oversight. So that's just a summary of what physical fitness entails, health fitness, and what medical fitness. This is Moses, the fitness master. I do believe that you are enjoying your day, that you're watching this video in the morning, watching in the evening, the afternoon, or at night. I believe, and I'm wishing you to have a good, wonderful, and productive time. Peace from here, Moses, the fitness master.